Hello, this is Dr. Nathan Way, and I'm going to be speaking about shoulder pain, how to get rid of the agony of shoulder tendonitis. One hint I want to pass along is that you probably don't need to have surgery. The shoulder is a complicated joint, probably the most complex joint in the body, and consists of three bones: the clavicle or collarbone, the scapula or shoulder blade, and the humerus, the upper arm bone. And these three bones are connected and supported by a very complicated arrangement of ligaments, tendons, bursae, and muscles. Pain symptoms with rotator cuff disease, the major tendon complex in the shoulder, is most acutely felt with overhead activities, pain at night, and pain felt on the outside part of the upper arm. Pain symptoms with a different tendon, the biceps tendon, which is a major tendon in the shoulder but not part of the rotator cuff complex, is pain felt in the front of the shoulder and pain that is aggravated with lifting. I want to also stress that when one talks about rotator cuff disease, the term rotator cuff tendonitis is probably not the proper term. The proper term is rotator cuff tendinopathy, because we're talking about wear and tear from aging, overuse, as well as impingement of bony structures on the rotator cuff. The biceps tendon is a different story. The biceps tendon is surrounded by a tendon sheath, and the tendon sheath can become inflamed. So the biceps tendon can become both degenerated as well as be affected by inflammation. And this is a diagram showing the biceps tendon inside a tendon sheath. It is separate from the rotator cuff. The diagnosis of shoulder conditions is made with history, physical examination, MRI, and diagnostic ultrasound. Early treatment consists of rest, ice, physical therapy, exercises to strengthen the rotator cuff muscles, avoidance of activities that aggravate the problem, and anti-inflammatory medicines. I mentioned those last because they're not particularly effective. More aggressive measures include steroid injection given with ultrasound guidance, ultrasound-guided needle tenotomy with platelet-rich plasma. Here we poke holes in the damaged and diseased tendon and inject platelet-rich plasma, PRP. This is an ultra-concentrate of whole blood that contains many platelets. Platelets are cells that are packed with growth and healing factors. A more recent treatment is Tenex. This is an instrument that uses a rapidly oscillating needle that injects fluid and also vacuums at the same time so that we can remove damaged and diseased tendon tissue. We've had great success using a combination of Tenex with PRP. A last resort, of course, is decompression surgery. In summary, shoulder tendonitis is common. It must be distinguished from other causes of shoulder pain. For example, neck disorders can cause referred pain to the shoulder. It's important to distinguish between rotator cuff disease and biceps disease. Conservative treatment is usually effective, and surgery is rarely needed. For more information about shoulder pain, you may contact us at the Arthritis Treatment Center, 71 Thomas Johnson Drive, Frederick, Maryland, 21702. Our phone number is 301-694-5800, and you can reach us on the internet at www.arthritistreatmentcenter.com. Thanks again for watching.